we need a certain amount of oxygen in the gas for us to be able to breathe adequately. If we take out the oxygen or we add too much oxygen, it can actually be a problem for us. Okay, oxygen toxicity is a real thing, hence why giving somebody oxygen when they don't need it can actually be detrimental and does not have a good effect. Let me talk about that really quick. What oxygen does is it acts as a vasoconstrictor. Okay, kind of like epinephrine is a vasoconstrictor, right? So remember, patients that are having a stroke, patients that are having acute coronary syndrome, these patients, they could potentially have a block, right? Either a block in their brain, a block in their heart. They're not getting enough oxygen to those locations. Now you might say, well, shoot, let me give that patient oxygen because obviously they're not getting enough oxygen. Oxygen acts as a vasoconstrictor. So if I give oxygen to a patient who is having a heart attack and they don't need oxygen, I'm just going to tighten up those blood vessels around the heart, and I'm actually going to limit the amount of oxygen that gets to the heart. Even though the heart needs this oxygenated blood, be wary that this can actually be a bad thing for our patients. Now, you might say, well, I'm giving them, a vasodilator with it. I'm giving them nitroglycerin. True. Hopefully you're giving them nitroglycerin. But if you find out that the patient has some sort of contraindication for that nitroglycerin, and then you just give them the oxygen, you're actually could potentially hurt them. All right. So be mindful on who gets oxygen and who doesn't. That's why I always say 94 to 99. That's kind of like the sweet spot when we start talking about oxygen sats. Try to keep in that range. Every cell needs a constant supply of oxygen to survive. Okay, so I always thought this one was really interesting just because it's different depending on where I see it. All right, so depending on the literature I look at, this little chart here kind of changes. Right here it says 0 to 1 minute cardiac irritability. So this is the cardiac muscle without oxygen. Okay, 0 to 4 minutes, the brain damage. There's brain damage, not likely. 4 to 6 minutes, brain damage is possible. 6 to 10 minutes without oxygen, brain damage is very likely. And then more than 10 minutes, irreversible brain damage. So with that being said, I'm just curious what you guys think. You can type it in the chat. If you call 911 right now, how long does it take for rescue or 911 paramedics to get there? How long do you think it should take or will take? We just said 6 to 10 minutes brain damage is very likely. So if somebody outside right now calls 911 and they're waiting for rescue to get there and this patient's not breathing and nobody's breathing for this patient, you're telling me that if I take over 10 minutes, the patient's going to have brain damage. Yeah, it's pretty damn close. All right. For my organization, I need to be there within 8 minutes. Okay. If I take longer than 8 minutes to get to a scene, I need to explain myself what happened. There has to be some sort of reason behind it, but it does happen. All right. And this is just a general guideline. Okay. Brain damage actually starts, it really is going to depend on the patient. Were they short of breath before this happened? And you know what I mean? So it's going to be different for everybody. The problem is people that do not start good quality chest compressions on people who are dead. All right. A lot of these patients that nobody starts chest compressions, they wait till we get there. Guess what? Even if we get them back, they're vegetables just because of this chart right here. All right. The brain damage is irreversible. So hypoxia, tissues and cells do not receive enough oxygen. That's all hypoxia is, all right? Lack of oxygen. Varying signs and symptoms. You have to know these signs and symptoms. First sign, restlessness, irritability, tachycardia, and anxiety. I'll tell you, man, when I used to fly as a flight medic, it used to drive me nuts, man. Whenever we go to altitude, if I had any patient that was slightly hypoxic to begin with. When we get to altitude, what do you think happened to their oxygen saturation? It dropped even more. So the first thing that always happens is the patient gets restless. Okay, they start moving around, they start playing with their buckle. If they have a pulse ox on their finger, they start taking it off, they're putting it on, they're taking it off, they start fidgeting around with everything. So it pisses me off. So I'm like, stop touching that, stop doing that. But they're irritable. Okay, pay attention. If your patient starts acting different, they start getting a little anxious, pay attention to their pulse oximetry. All right, it could be declining. Some late signs: mental status change and weak pulse and cyanosis. All right, so if you see cyanosis, it is considered a late sign.